Hello, my name is Tiffany Edelman. I'm a registered nurse with AvevoRx Specialty Infusion Pharmacy. This video is going to demonstrate infusing an IV medication using the Elastomeric device. Prior to use, remove your medication from the refrigerator to ensure it's at room temperature. Never speed warming process by heating or microwave your medication. Clean your hands thoroughly using soap and warm water for at least 20 seconds. Dry your hands with a clean towel, gather your supplies, and place them on your clean work surface. You will need an IV medication ball, also referred to as Elastomeric device, 2 normal saline flushes, 1 heparin flush, alcohol wipes, Purist cap, and a sharps container and/or trash container. Check the label on the ball, making sure that the correct name of medication, the volume or amount of medication is correct, and check the expiration date. Next, you're going to flush your IV line with saline. To remove your Purist cap, scrub the needleless connector on the end of your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from your saline flush syringe. Hold the syringe upright and gently push plunger to remove air from the syringe. Do not touch syringe tip after removing the cap. Attach your saline flush syringe to the needleless connector using a push and clockwise twisting motion. Open your clamp on your IV catheter and/or IV extension set. Flush IV catheter using a push-pause method. To do this, push a small amount of fluid, pause for 2 seconds, and repeat until prescribed amount of flush is infused. Close your clamp on your IV catheter and/or IV extension set. Remove the saline flush and discard in a trash container after use. Scrub the needleless connector on the end of your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from medication tubing. Attach your medication tubing firmly to needleless connector. Use push and clockwise twisting motion until secured. Open clamp on your IV catheter and/or IV extension set. Open your clamp on the medication tubing. If the device manufacturer requires taping to skin, use tape provided. Make sure flow restrictor is taped directly to your skin. Do not cover filter with any tape or material. This would be demonstrated by your nurse. Inject medication as indicated on medication label. Close clamp on medication tubing. Close the clamp on your IV catheter and/or IV extension set. Disconnect medication tubing from needleless connector on IV catheter. Discard your Elastomeric device as instructed. Next, we're going to flush your IV line with saline. Scrub needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from the saline flush syringe. Do not touch tip. Hold syringe upright and gently push plunger to remove air from the syringe. Attach saline flush syringe to needleless connector using push and clockwise twisting motion. Open clamp on IV catheter and/or IV extension set. Flush IV catheter using push-pause method. Close clamp on your IV catheter and/or IV extension set. Remove saline flush syringe and discard in trash container after use. Next, we're going to flush your IV line with heparin, if ordered. Scrub your needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to dry. Remove protective cap from heparin flush syringe. Do not touch syringe tip after removing the cap. Hold syringe upright and gently push plunger to remove air. Attach your heparin flush to the needleless connector on your IV catheter using push and clockwise twisting motion. Open clamp on IV catheter and/or IV extension set. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set. Remove heparin flush syringe and discard in trash container after use. Scrub needleless connector on the end of your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Apply a Purist cap to the end of your needleless connector. Call your nurse or doctor with any questions or concerns. If you ever meet resistance when flushing your catheter, please do not push any further. Clamp your line and contact your pharmacy.